It has been over 2 months since the province moved to step 3 of its roadmap to reopen. During this time, we have made incredible strides, thanks to the tremendous efforts of Ontarians adhering to public health measures and going out to get vaccinated. Over the past week, nearly 87,000 more Ontarians got their first shot, and over 137,000 more got their second shot. Between September 1st and September 22nd, the 7-day average for first doses administered increased by more than 6%, from over 11,400 doses to over 12,000 doses. And almost 80% of eligible Ontarians are now fully vaccinated. And I have to thank everyone that's come forward. 4 out of 5 eligible Ontarians are now fully vaccinated. With public health and healthcare indicators currently stable and proof of vaccination now in effect, we are able to recommend cautiously easing capacity limits in certain settings. For these settings, the capacity limits will increase to up to 75% capacity or 15,000 people, whichever is less, for unseated events, and up to 75% capacity or 30,000 people. Effective tomorrow, Saturday, September 25th at 12:01 a.m., capacity limits will be increased for many of the indoor settings where proof of vaccination is required. This includes sporting events, meeting and event spaces, including banquet halls, conferences and convention centers, concerts, theaters, cinemas, racing venues, and studio audiences at commercial film and television productions. These settings will be able to operate at up to 50% capacity or 10,000 people, whichever is less. This is an increase in the hard capacity cap for these settings. Capacity limits will also be increased in certain outdoor public settings, such as sporting events, concerts, theaters, and racing venues. For these settings, the capacity limits will increase to up to 75% capacity or 15,000 people, whichever is less, for unseated events, and up to 75% capacity or 30,000 people, whichever is less, for seated events. In addition, to maintain the safety of large outdoor events, proof of vaccination will be required in outdoor settings where the usual maximum capacity would be 20,000 people or more. Increasing capacity limits does not mean that we can let our guard down. We must remain cautious and humble in the face of this Delta variant. Although several of our key indicators are stable and our vaccination rates are among the highest in the world, we must all remain vigilant and continue following the public health measures and advice. We must continue to work to vaccinate as many Ontarians as possible, to achieve the highest immunization rates we can, and to increase our levels of community immunity and protect those who cannot receive the vaccine. Thank you, and I'm available to take questions.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
From Shalima Maharaj at the Global News.
Hi there, Doctor. Thank you so much for taking my question here. I just want to start off here, obviously, with this announcement today. Can you sort of, delve into, why now at this point? I know obviously we have the passporting or certificate system in place, but why is now the right time to be taking this next step?
I think we've done very well in Ontario. We've been stable for the last several weeks, and we need always to have a balanced and proportionate public health response. As we move indoors and as we go to these events, we have the added benefit now that the majority of individuals must be vaccinated to attend these events through the certification process. There will be some that will rarely have a medical exemption, but for the majority, they will be protected through vaccination. They will be wearing masks. They will be screening and monitoring for any symptoms. Obviously, if they have symptoms, they shouldn't be attending. And I do think that is much safer environment that we can start to safely and cautiously open. We'll monitor these caps over the coming weeks and ensure that this process remains safe. I'm confident that we can do this safely and slowly and cautiously because we all need balance. We've made sacrifices over the last year and a half, and so have these businesses. And I think this will allow them to open safely and not be sources of infection or outbreak. And I do think the certification validation process is a game changer for these businesses to allow them to open safely.
Follow up.
And just this next question is for my colleague, for Karen Lieberman. She is working on a story today. I wonder, is there any enforcement happening for businesses and restaurants that are not currently abiding by the vaccine passport system? And what are the consequences for those businesses?
Well, I'm sorry to hear. We've given plenty of warning for businesses that this would be adopted on the 22nd of September, and on October 22nd, we'll have the technology to be able to scan the QR code for your vaccination certification. If businesses aren't adhering, we want a progressive enforcement, so educate them, teach them how to read vaccine certificate, what they should be looking for, checking ID as well. And if despite education and prompting and nudging, they still aren't adhering to this, I think, very prudent and necessary precaution, they can be fined for not adhering to this regulation. And you can ask or phone your municipal bylaw officers through your local government to attend. And there are significant fines if they do not adhere to this basic public health measure to protect all of us as we go inside through the fall and winter.
Next question.
From Randy Rath at CHCH TV.
Hi, Doctor. We're entering into cold and flu season. How do people that have, a cough and sniffles, how do they know if they should go and get tested for COVID or if they just simply have a cold?
Really good question. And it's very hard to differentiate. You're absolutely right. The respiratory season, the fall viral respiratory season typically starts the third week of September and continues all the way to April. And there's no distinguishing unique symptom between COVID and all the other viruses. They all can give a fever, a new onset of cough, or increasing shortness of breath. And some give more flu-like symptoms like muscle aches and joint aches. So I would just caution everyone, if you get the typical symptoms of flu or COVID, that you should stay home, you should get tested, and even if vaccinated, get tested, because there is a risk that you're carrying that virus and that you'd be infectious to others. Luckily, all the other precautions we take as a community, the distancing, the hand hygiene, the masking in indoor venues, will reduce our combined risk of acquiring these other viruses as well. So we had in the previous year had very low risks for influenza and as well for other respiratory droplet viruses. So the measures will help protect us all from all of these viruses, but we all have to be cautious. Any new symptom consistent with COVID, we should stop what we're doing, stay home, not put anyone else at risk, and get tested, especially if you work in a setting where you care for vulnerable people, like in a hospital, long-term care, or any other home or congregate setting.
Follow up?
We've heard stories recently of people having difficulties finding a place to get tested for COVID because a lot of the testing centers are shutting down. Are we going to have to reopen these centers? How can people get tested if there's no place to get tested?
Thank you for that question. I'm very concerned that people should have access to testing if they develop respiratory symptoms, new respiratory symptoms compatible with COVID. We're monitoring the time to get an appointment, the time from the appointment to a test, the time from a test to public health hands. All of that is essential if we're going to be able to continue to keep COVID under control across Ontario. And if we need to increase the number of assessment centers, we will. Ontario Health is monitoring this situation very closely. We discuss it almost on a daily basis, the time to get an appointment. And I do realize and want to identify there have been issues in Ontario. The delays are too long in my liking, and we're doing our best to address that wherever we have a wait time that builds up for testing, because we want to make it convenient for Ontarians. And I want the information like you want the information to be available and accessible in a rapid turnaround time for both the patient and for public health, so public health can continue to do the great work they do and live in the midst of this virus.
Next question.
From Chris Herholt at CP24. Please go ahead.
Hi, Dr. Moore. You've suggested as much before, but could you describe for me under what circumstances you would actually allow the deployment of rapid tests to a school? In what scenario do you think that would be helpful?
Oh, so thank you for that question. It is an evolving science, and we're looking at this on a regular basis. I think I've been discussing it with Dr. Juni and others. It would be difficult for us to test 2 million children every day or twice a week or 3 times a week. So we're trying to have a strategy where if the community rate is rising, like it is in some of our areas in Ontario, and there are certain schools that continue to have outbreaks or high absenteeism, that's an environment where I think having a test to stay in the class or test to continue to be at the class may be very, very helpful to keep children in the classroom. So we've looked at the science of, let's say we have an outbreak in a classroom, and we're right now, the outbreaks have been limited. They've been spreading from 1 child to 2 to 4 children. So with Delta, I think that's a win that we've been able to limit the spread to that few. And that's a good news story. But 24 other children may have to go home, or 26 other may have to go home and get be off for 10 days. So we may be able to put in a testing strategy that we test those other contacts on a regular basis. And if they don't turn negative, they can stay in the classroom. And that's one way of using effective testing to keep children in the class. The other is if you have a high risk in the community. So there are communities that have over 100 per 100,000 cases on average per week. And in those areas, we could put in testing in the highest area in a community, a school, and ensure that we're keeping kids in the classroom and doing it safely. So we're looking at multiple strategies of putting this in play to protect the children, the classrooms, the workers. And I think it should be risk-based and targeted. And I'm speaking regularly to the science table, Public Health Ontario's testing table, and our expert panel to get their advice. With Delta, we want to limit the spread in classrooms, but we also want to keep kids in the classroom as best we can. And we're going to find that right balance over the coming weeks, I hope.
Follow-up?
Okay, so on that, across the province right now, parents are setting up their own rapid surveillance programs for their children's schools. They're doing it by finding backdoor ways to access the federal stockpile where there are still millions of unused tests sitting. They're asking around at businesses who have unused tests. They're WhatsApping each other, asking grandma, doing all sorts of things, all without any help from public health units or the provincial government. One parent described it to me like it's the Hunger Games out there, trying to get a hold of these tests for their kids. Should parents be doing this by themselves? And is there any plan in development right now to distribute the tests in a surveillance mode, even if it's just to the schools in the highest risk areas?
Oh, yeah, we have plans in play, and we've just discussed it this morning with Public Health Ontario leadership and are prepared to put them in play in high-risk communities and in active discussion with some health units in the Southwest where they have high community rates of infection. I think it would be prudent in those instances. I'd be cautious in adapting a strategy in a setting where you have very low risk of infection and where you haven't had significant outbreaks in the classroom, and or if you have very high immunization rates in the students, such as high schools. Our high schools seem to be doing relatively well, and I don't think would benefit from an additional testing strategy unless it was an exposure and we wanted to test to keep people in the classroom to ensure that they were able to stay in the in-person venue. But all that being said is that we're working on this. I don't think parents have to go ahead of us. And I do think we're going to put the best science to play to protect our schools.
Next question.
From Colin DeMello at CTV News.
Hey, good afternoon, Dr. Moore. Wanted to ask about restaurants. So restaurants are still facing capacity limits, as you know, yet everyone dining inside has to be now fully vaccinated. Can you give us a reason for why those capacity limits for restaurants are not being removed right now?
Thanks, Colin. I think this is typical of Ontario's slow and cautious approach. We've had a lot happening in this month. We've had children return to both elementary schools, secondary schools, colleges, and universities. We have businesses where workers are returning to the workplace, and we have more and more people going indoors. So you have our commitment to review the data, to review the safety, and to open our economy in a slow and cautious way. And at present, that's certainly on our radar to review capacity limits in other venues. But slow and steady has been our mantra over the last several months. It's done us well. And I want to keep our rates down. I want to keep our impact on the acute care sector at a minimum. Right now, everything is relatively stable, and I think a gradual approach is prudent.
Follow-up?
Okay, I appreciate that. I had another question on another topic related to vaccine certificates. So the Premier has said that vaccine certificates are going to be a temporary measure, and he's deferred to you to create the criteria to eliminate the requirement for proof of vaccine certificates. So could you give us a sense of how long you think proof of vaccine certificates will be with us, how long they'll be employed, and what do you think will be required, or what do you want to see before saying, okay, it's time now to lift that requirement?
I do think they're going to be with us for the fall and winter. That is at a minimum of those difficult months. I have seen modeling where we have a significant rise in January and February after the Christmas holidays, and that is disconcerting. So what we'll be monitoring is the new cases, impact on hospital, impact on intensive care unit. Certainly, we're monitoring for any change in the strain. What I hope that Ontario will achieve is the highest rate of vaccine we can, and that I hope that'll be in the 90% range of first and second doses. I think once we get that higher rate, and there'll be others that will have natural immunity, that will definitely slow the virus down. And as we see the virus slowing down and not able to impact our health sector, our hardworking nurses in the intensive care unit and emergency departments, then I think we'll slowly pull back on all public health measures over time. But we'll do it in a stepped manner. We'll do it prudently and cautiously, and knowing that the passport verification certification process was really essential as a balanced approach to keep our economy going forward. We all, I think, want to keep the freedoms we have right now. We want to make steps forward and not backward. And I think this is an important means to continue to have safety as we go indoors and minimize the impact of this nasty, aggressive virus on our communities.
Next question.
From Alison Jones at the Canadian Press.
Hi, Dr. Moore. I know there's a fair bit of interest in how your announcement today affects the Rogers Centre and Blue Jays game. So I was hoping you could talk a little bit about that, whether the stadium is going to be still considered an outdoor venue when the roof is closed? And what would you need to see to ease capacity restrictions even further for other major sports teams looking at their regular seasons?
Yeah, so as of Saturday, September 25th at 12:01, they will, I believe, be able to have 30,000 people in the Blue Jays Stadium. I'm a big fan, want to see them succeed. They've been great partners in having early adoption of the validation of immunization status and/or testing. They're moving to complete immunization certification, which I very much appreciate. So 30,000, we consider it an outdoor stadium, even if the roof is closed. We've worked with them to understand their ventilation system and their air exchange, and it is actually a very high air exchange turnover. We're confident, even with the roof closed, it can be, given the amount of air and space, that we can continue to consider it an outdoor venue.
Follow-up?
Yes, thanks. And somewhat related, I guess. You were mentioning earlier about how our cases have been fairly stable for the past few weeks. And I'm just wondering what you see as being behind that. I know throughout the summer, you were warning of a fall surge, saying when school was back in session, we were going to see a big spike in September. So what is behind this fairly stable rates? Is it the vaccination levels? What is at play?
I think it's a combination of factors. And number one, I have to thank all Ontarians. When I'm out and about in Toronto now, I'm seeing people continue to wear their masks, continue washing their hands, being kind and considerate to one another. I'm seeing more and more people continue to come forward and get immunized. I think Ontarians are being prudent and cautious and have realized that this virus can take off at any given time if we let our guard down. Sadly, we only have to look out west to see what can happen if we let our guard down with this Delta. I am just so thankful to all Ontarians who have adhered to all of the best practices. It takes every individual contributing to community safety, and we're doing it. And I'm proud of every Ontarian for their effort and for their cautiousness. And if they can bear with us, we will slowly and cautiously open up our economy and follow the data and continue to have great and higher immunization rates that will only further limit the ability of this virus to interfere with our lives.
Next question.
From Adrian Gabriel at City TV.
Hey, good afternoon, Dr. Moore. I was speaking this afternoon as well with one of your public health colleagues who said to me that he feels it would actually make more sense to increase capacity at restaurants first before larger venues. And he referenced this because of what he calls pinch points in stadiums, in large venues, when people are lining up at concessions, when people are cramming onto transit, when they're coming in and going out. He said it would make more sense perhaps to do restaurants first, but the province has decided to do large venues first. Wondering if you could respond to that statement and the concerns around pinch points and large venues over restaurants.
We're still working with the large venues, and absolutely we want to maintain as best distancing as we can, minimizing lineups, very much concerned about washrooms and any other setting where the distancing is decreased in these venues. We do, though, still want a staged and phased and reasonable approach. I think given what we've gone through over the last year and a half, and given that the hockey seasons are starting, that it was fair and reasonable to start with those groups and ensure that they can get back into our communities across Ontario for the Ontario Hockey League, for example. I'm very happy that they'll be able to have in person this year. And there were just times like their hockey season has to start in the first week of October. So we had to ensure that they could do it safely, and we did it in a staged and phased way. And we will continue to address the other venues that we're holding back, like restaurants and gyms, and reassess over the coming weeks. I hope we can give it a 3 to 4 week period where we monitor the data, but you have our commitment that at present we'll follow the data as best we can. And at present, the restaurants are only limited by capacity and distancing.
Follow up?
Thanks for that. I'm just switching gears to vaccine certificates. The provincial government has said once the QR code, or each unique QR codes are available to Ontarians on October 22nd, that people will still be able to continue to be allowed to use the paper receipts that we have either printed or have got a screen grab or got from the province of Ontario's website. I'm wondering if you're aware of any plan to phase out the current vaccine certificates, because it's been widely publicized just how easy they are to manipulate, to change a name, to change a date of birth, and to phase those out so that solely we're using the QR codes. And would you be in favor of that?
I'm confident that the vast majority of Ontarians will follow the rules, that will not try to cheat the system. This is a system that's been set up to protect us, to limit the spread of disease and infection in these environments as we move indoors and closed spaces. So I hope people don't try to bend the rules. I do hope that this will nudge to come forward and get immunized. And if there is a concern that there is a significant proportion of Ontarians misusing the system, we will tighten it and enforce the use of a QR code if we find that there is a significant proportion that are misusing it.
Last question.
From Lorenda Redekop at CBC News.
Hi there, Dr. Moore. Have you had any cases linked to pro sports venues or any of the places that you've announced where you're increasing capacity? And then what measure will you be looking at to decide whether you have to go backwards and decrease capacity again?
Yep, we're in contact with the health units that have these large venues, mainly Toronto and Ottawa, but some other hockey and other venues are across Ontario. And we haven't been notified of any significant exposures in these environments. Sometimes it's difficult to tie them back to one particular exposure, but at present, they appear to be safe. I think they're safer with the vaccine certification process now, and masking and hygiene and screening. So all of these precautions are working for us in Ontario. And these venues, I do believe, remain safe, and we just want to make sure that they remain that way.
Follow up, and this is the last question.
For those of us who've gone to Blue Jays games or watched them on TV, we know that there's supposed to be masking there, but just take a look and the vast majority of fans are not masked. Now that we'll have Raptors and Leafs games starting, meaning indoor venues, how will you ensure that rules are being followed, and how much of a concern is this?
It is still a concern because the vaccine is not 100% effective. It's roughly 88% effective against Delta. So at any time, even amongst vaccinated people, they may be carrying the virus, and hence the rules that we put in play now of slow, steady increase in capacity, but also maintaining masking and hand hygiene and distancing and screening. For those venues, I am concerned that they could be a source of infection to others, but we'll have to continue to monitor that data, especially indoor venues with large numbers of individuals. We'll be prudent, we'll be cautious, and we'll follow the data if and when we further reduce or modify any caps.
Thanks, everyone.